A number of our clients contacted us of late to ask in relation to whether a social services financial assessment can be undertaken and whether it should be undertaken when somebody is in the pursuit of continuing healthcare funding. Now, at Compass CHC, we specialise exclusively in continuing healthcare funding, and as such, we are not able to give any formal advice into the intricacies of the social services funding assessment or financial assessment. However, we can talk about, of course, the basic principles surrounding it. Now, if an individual's needs are primarily health needs, they are entitled to continuing healthcare funding to meet the cost of their care in full, regardless of what their financial position is. So if their needs are deemed sufficiently complex, intense, or unpredictable in their nature, they're entitled to NHS funding to pay the full cost of their care. It's not a means-tested assessment, so it's utterly irrelevant what assets or finances the individual has. That surpasses and overtakes all other matters, all other issues, including the social services financial assessment. If an individual has over £23,250 and they are not entitled to continuing healthcare funding, then they are obligated to meet the cost of their care in full until they reach that lower threshold of £23,250, when they will continue to have to part contribute until the lower limit threshold of £14,000 is reached. Now clearly, in order to be able to determine what money the individual has and whether they have over £23,250 or under £14,000, a financial assessment has to be undertaken, and that would be completed by the social services team. Now what is crucial here, however, is that until somebody has been determined as being eligible or not for continuing healthcare funding, no social services financial assessment should be undertaken, because clearly, if they are entitled to continuing healthcare funding, the financial assessment by social services is utterly irrelevant. So what we would suggest is, in the circumstances where social services make contact and are looking to instigate a financial assessment, the first response should be that you, of course, are happy to comply with that process, but only at the point in time that the NHS and social services have met their obligations to undertake a continuing healthcare funding process. Because why should an individual be paying if it's not first been determined that whether or not the NHS should be? So that is what we would suggest. Now, if a continuing healthcare funding assessment has been undertaken, for example, you're completing an appeal, the base position is whatever the outcome has been of the assessment. So, for example, if it's been a negative outcome, at that point, it reverts then to a means testing position. Do they have over £23,250? If so, they have to pay. Now, obviously, any successful appeal in the future would mean that any funding paid from the point in time of the negative assessment would be reimbursed. However, the key factor is that at the point in time the assessment has taken place and it is negative, from that point on, it does revert to a means testing position. So you do have to pay immediately if you're obligated to do so because you have money over the threshold. It's not the case that you can say, well, pending an appeal, I will pay. The NHS will not meet the interim costs, and neither will social services. Now, you are not obligated to comply with a financial assessment by social services. However, if you refuse to do so, the social services will simply say, well, on that basis, we can only assume that the individual has assets over £23,250 and therefore has to pay. Some people choose not to partake in a financial assessment because if, for example, they know that the patient has well in excess of the £23,250 and is never likely to reach that lower threshold and will therefore always have to pay, what is the point in having an assessment to confirm the same point? For example, if somebody owns a property worth £400,000 and has £200,000 in savings, even at a rate of £50,000 a year for care costs, it's unlikely that they would ever reach a threshold of having spent all of that money to then dip below the £23,250 to receive any form of benefit and financial contribution from the state. In that situation, some people may elect not to engage in a financial assessment because they may feel it's rather obtrusive if it's never going to result in any benefit to them or the patient. What we would suggest is that if you have any specific queries relating to social services or social services funding, or indeed these financial assessments, you should consult perhaps with a specialist solicitor or an accountant. It's not something that Compass CHC specialise in. We are exclusively experts in continuing healthcare funding. But hopefully this broad explanation of the circumstances at which point a social services financial assessment may bite or be necessary has been a useful exercise. Thank you.